Having conversations with people that you don't know can be difficult at the best of times, but it can be overwhelming when you have experienced trauma. And that is why I'm going to be telling you about trauma-informed approaches. Hi, my name is Mina and I am a service user and trainer. I have co-delivered and co-designed trauma-informed care training to various professionals across Tower Hamlets, including people in the charity sector and in mental health care. This is an approach that can be applied to everyone. Traumatic experiences can vary depending on who you are and what support system you have around you. Trauma can be described as an event or circumstance that causes harm in some way, and that harm can be physical, emotional, or even life-threatening. Common experiences in Tower Hamlets include discrimination, bullying, poverty, health issues, and other things that can affect the communities that we serve.
My name's Rachel. I am a patient experience midwife here at the Royal London Hospital.
My name's Ellie. I'm a midwife at the Royal London Hospital.
My name is Mary Nisi. I'm the Assistant Director of Client Services for Providence Row Housing Association.
My name's Sophie. I'm a support worker at Providence House.
We look after a wide range of women from different ethnic backgrounds. Some women may have experienced domestic abuse.
It might be that they're teenagers, it might be that they might have recently arrived in the UK.
A lot of our residents here, unfortunately, have come from a background where they have been homeless. They have experienced lots of different trauma and have lots of different support issues, which could be around drugs, alcohol, mental health, anger management, safeguarding. The trauma-informed approach enables you to really look beneath some of those behaviours.
Pregnancy, sometimes we don't really know much about a woman, and sometimes we find that actually when it comes to labour, that's the time when we start to notice different behavioural patterns.
With one of the residents, we hadn't realised that when speaking with him, he had certain words that would trigger him. He would get quite angry.
Working with this trauma-informed approach, it has enabled us to look at different ways of building those relationships.
Trauma-informed approaches are built on 6 principles: safety, physical and psychological, trustworthiness and transparency, collaboration and mutuality, peer support, empowerment, voice and choice, and addressing cultural, historical and gender issues. These approaches mean that services and organisations realise the impacts of trauma, recognise how trauma shows up in people, respond by integrating this understanding into practices, procedures and policies, and resist re-traumatisation, preventing situations where people would feel that sense of fear or being unsafe again.
So one of the main things that women felt was in labour, particularly for women that may have experienced trauma in the past, they felt that one of the main triggers would be things like being strapped to the bed, not being able to move around.
At the first midwife appointment, we ask women if they have any history of trauma or sexual abuse, so we can tailor our care based on their answers and make sure other professionals are aware to approach that sensitively. We make a birth plan with the woman that would take into account her needs, especially with the specific population that we look after. For example, a young Bangladeshi mother might prefer to have female healthcare professionals at her birth.
A lot of the residents wouldn't necessarily want to come down from their flats, so we had to ask them what we can do to make them feel more safe, what activities they would like to do.
We realised very much that the language we were using wasn't always the best language. Rather than saying we were going to interview a resident, for example, we talked about having conversations. And when you were having a conversation, everything was so much more meaningful.
I love the rivers.
The residents would come and they would say what they would like, and then the staff team would work with them to try and deliver on those change ideas.
For example, on Wednesdays we do cooking. Putting music on the radio has really encouraged conversations because it brings up memories for people, gives us more insight into what their past experiences are. and build up trust between the staff and residents so that they can open up a bit more to us.
We had one resident here who didn't really engage, didn't share very much about him, and he wasn't interested. But as they consistently happened every week, he would pop in, see what was happening.
And this consistency, it's like really encouraged so many more people to come down.
And it brought a new energy to the project.
Giving them more choice empowers them, makes them feel more included.
Women having choices in their care is really important. She'll feel empowered and she's likely to have a better experience. Even when it comes to providing care in an emergency, you have to stay calm so that you can still communicate with the mother in order to get her consent and make sure she's making an informed choice. Healthcare professionals can be under a lot of pressure, so I think that's why the training was really useful as a kind of reminder that even when you're under pressure, that communication is still really important.
We've had reflective practice sessions put in now, which take place once a month, and supporting each other in the best way so that we can support the residents, being more sensitive, avoiding re-traumatising.
There have been some staffing issues which puts everyone on a lot of pressure when we're understaffed. We have monthly psychological supervision. That's a good opportunity to kind of debrief about those cases. And I think effective teamwork is really important as well.
And I think by working on the well-being of the staff, it's also improved the way that they care for women.
I think the relationships between the residents and the staff have changed. Everything was about learning, and that sense of learning kind of catapulted itself in a way.
Definitely think that we've got better at recognising that actually someone's probably gone through something quite traumatic and is just I guess telling us, but in a different way to verbally.
Thinking and acting in a trauma-informed way can help orient services to be more person-centred. It can break down barriers, establish trust, and build on people's strengths. This means that people will be more open to seeking help and that those services will align with what they're looking for. Being trauma-informed is a journey, it is not a label. It is an approach that helps to support people through compassion, understanding, and power sharing. You can build this into your organisation or service by speaking with people that you support or work with about where to start.